Namaste Vidya. Hamesha khush raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's lecture, we are going to understand how to count the vertebra for examination of a patient in nervous system. So, how do you count the vertebra? We have four different types of vertebra. We have cervical, thoracic, lumbar, and sacral. So how to count the spine or the vertebra? How to count that particular vertebra for finding out the lesion or the nerve compression? Because many times a patient of nervous disorder or sensory neural loss comes to us and we see that there is a compression at the C7, T12 or L45, S1. So how do we come to know that at what level that particular compression is there? So for that, we need to count the vertebra. And in today's lecture, in today's clinical lecture, we are going to demonstrate how you can count the vertebra. Just listen to the direction first, and then when you come to the college, we are going to discuss these things practically. So first of all, just listen to them carefully, the different steps. I will repeat these things 2 times so that we can get a clear picture in your head. The spine of C7 vertebra, that is cervical 7 here, is prominent at the level of the shoulder. So the prominent spine is C7, cervical 7 spine. That is prominent. You can feel that particular spine by your finger, tip of the finger, at the level of the shoulder, from which you can palpate the upper dorsal vertebrae downwards. So from C7, you can palpate it downwards. All right. So on the front of the body, there is a line or demarcation between T2 and C4 at the level of clavicle. So at the level of clavicle, there is a demarcation between the T2 and the C4 at the level of clavicle. The nipple lies at the level of T6. So this is T4, T2 and C4, and the nipple lies at the level of T6 and the xiphisternum at T8. The umbilical at T10 and inguinal ligament at T12. So by these things also, you can get a clear picture of the vertebral level. So I will again repeat it. The spine of C7 vertebra is a predominant spine, after which you can count T1, T2, 3, 4, 5, 6, 7, 8, 9, 10, and so on. Then you can palpate the upper dorsal vertebrae downwards. On the front of the body, on the front side of the body, there is a line of demarcation between T2 and C4 at the level of the clavicle. The nipple lies at the level of T6 and the xiphisternum at T8. The umbilicus lies at the level of T10 and the inguinal ligament at the T12 level. So these are the demarcations which help you to reach at a particular point. In case of a patient of neurological disorder. However, in the lower dorsal region, on the back of the tip of a spinous process, marks the level of the body of the vertebra below. Similarly, the line between the anterior iliac spine passes in the interspace between L1 and L2. So if you mark the anterior superior iliac spine, then it passes through the interspace of L1 and L2 level. The spinous process above this line is L1 vertebrae and below this line is L2 vertebrae. This can also constitute the landmark to count the diseased vertebra. So our whole exercise is to find the diseased vertebra, the level of the diseased vertebra, and the nerves coming out of that particular vertebra, so that we can reach at the diagnosis, a proper diagnosis. In case of a disease of the spine. I will again repeat the steps of counting the vertebra. The spine of C7 vertebra is prominent at the level of shoulder, from which we can palpate the upper dorsal vertebra downwards. On the front of the body, there is a line of demarcation between T2 and C4 at the level of the clavicle. The nipple lies at the level of T6. You should always remember this thing, T6, the nipple, and the xiphisternum at the level of T8. These are the landmarks that you should keep in your mind. All right, C7, predominant vertebra, T2 and C4 at the level of clavicle, T8, xiphisternum, nipple, T6, and umbilicus at the level of T10, and inguinal ligament at the level of T12 vertebra. Just reach there and you can identify that yes, this is the vertebra, despite other than counting at the back. So these are the points which you should always keep into your mind. However, the lower dorsal region of the back, the tip of the spinous process, marks the level of the body of the vertebra below. Similarly, in between the anterior, so the anterior iliac spinous process is the space between L1 and L2. The line above it is L1 and below it is L2. The spinous process above line 1 is L1 vertebra and below is L2. This also constitutes the landmark to count the vertebra, the diseased vertebra. So this was all for today. How do you count the cervical vertebra for finding out the diseased vertebra? All right. In case of a neurological disorder of the patient who is coming to you, you can also for the confirmation you can also do the or ask for the MRI to be done and to reach at the particular diagnosis. So this was all for today. In the next lecture, we are going to discuss about the neurological history taking. How to take the history in case of a neurological disorder. So this session is powered by digital version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.